rather than kind of doing a needs assessment, where you go out and ask all kinds of people exactly what they need, we kind of responded to what we saw and what we felt. And then as we got more sophisticated, then we could begin asking, and one of the studies that's been done is a study that was asked nurses basically what would be helpful for them to know in working with oncology patients. And I'd like to close with this and then open it up to questions, and then we need to take a little break so our next speaker can have a chance to get set up. But so many of you may, or some of you may have known Ida and her journey through cancer, which was difficult, and yet she was an absolute inspiration to all of us who knew her. And she passed away this past year, this past fall, and we all dearly miss her. But she was at the survivorship workshop when we were here in January last year. And she spoke volumes to us just in her very short way, in her very calm way. And she began her story by talking about when she was paralyzed and how when she would go out, she would be in a wheelchair. And they'd get to places where obviously there were steps and they couldn't get up. And she talked about one, they were trying to get in a bank. And she talked about her husband and then some volunteers who came along, just some people walking by, who picked up the wheelchair to get her in the bank, and her response was that she felt like she was Cleopatra, sitting in the chair and feeling very regal at that time. And she had deep, deep spiritual faith as she went through the journey, incredible family support, incredible support from this organization. She was the one that began the volunteer program, set it up, managed it for a number of years, has encouraged it ever since. But one of the wisdoms that I think she mentioned to us that I think is critical is that she asked us the question, because this is a term that you hear often, in fact almost all the time. And that term is, do you really want to use the words fighting cancer? Or sometimes it's referred to as battling cancer. Because what it says, and what it said to her, was sometimes you don't have the strength to battle by yourself. And the I focus was what was so important by these words. That I'm expected as a cancer patient, survivor, to do the battle, to work hard for me to get better. But what she was saying is that no, you actually need a whole team. You need the treatment team, you need the support team, because that's what really leads to healing. So when I began to think about this, is perhaps what we should focus on in terms of this language of fighting cancer is perhaps we should focus on journey, let me try this again. I do speak English, just in case you haven't guessed. Journeying together with those affected by cancer, which includes people who have cancer, people who are caregivers, nurses, physicians. It includes this whole world, anyone who is affected by cancer, meaning anyone who works with or has cancer themselves, to provide treatment and support to basically assist in the healing process, which is very important. So I'll close with that and ask, I have a couple of resources I just wanted to share with you, and then we'll put in the resource center if you'd like to look at them. But do you have any questions that I might answer from the presentation? Please.
At what stage you were diagnosed with cancer?
In terms of my stage that I had, when I was diagnosed at stage 1. So basically it was the lowest level stage. But over the years, they have changed that stage to stage 0. So actually I got downgraded, which was very good. And so it was did not spread. I had no lymph node involvement, so that I was extremely fortunate in terms of the type of treatment I could have. But I was also fortunate because my mother had cancer, and because of that, her oncologist had me start mammograms in my 30s. And so I actually, which were actually interesting, mammograms at the time, I won't describe them because it's really kind of funny, because I guess I will describe them. They didn't have the mammogram machines. They used to have you lay at a table and put balloons under you to position you so that they could take the picture. Well, the stupid balloons kept moving. So then they'd have to reposition you again with the balloons. So I experienced all levels of what having a mammogram is like. But yes, I was very fortunate. Please.
I want to ask one question.
Sure.
I have a friend. She is already bedridden. So how do I talk to her?
Okay, that's a very, very good question. My sense is, the first thing is to get a sense of who the person is. It's a friend that you know. And so knowing what is her beliefs about the where she is now that's bedridden. Is it something that she accepts? Is it something that is very difficult for her? And trying to have her talk about it to you so that you can then respond to her. And even bringing a little card or a little gift, flowers, something that shows you care. And then just knowing that, which I think is sometimes the hardest part for someone who's well, that and this is, I'm not quite sure how to say this even in English, let alone in Bahasa, which I can't speak, by the way, unfortunately. So I can't say it in Bahasa. But knowing that you're not afraid of the person that's there in bed and of the dying process, that this is what's happening at this point in time, though it may not be. It may just be a stage that they're going through because of their treatment, and they'll come out of that. And I don't know if that's helpful. Can you ask anything more that would help me respond?
So is it okay if I talk about death?
Yes.
So what are the preparation?
Mm-hmm. Yes.
Because the cancer is already to the brain.
Is it already to the brain? Yes.
She's already.
Yeah. If this is a very close friend, if it's just a casual friend, no. But if this is a very dear friend, and she feels comfortable about it, she may want to talk about it, or he may want to talk about it very definitely, and especially with a close friend. And I know that I had a very, very dear friend, my best friend actually since when I was in 5th grade in grade school, who passed away from cancer. It's been 8 years now, and I still miss her dearly, and I talk to her a lot still. She's what strengthened my life still at this point. And I can remember talking with her about the dying process. Because she knew it toward the end, especially the last 6 months, that was basically what was going to happen.
And I have another friend also.
Okay.
At the same time, she has lung cancer, and doctor gave her less than a year to live.
Right.
And can I advise her not to go through the chemo again because it's so suffering for her?
That's the one piece that I would say, and I would leave this to my medical specialist, but I would say no to that. And the reason why I would say no is that that's an individual decision that the person has to make. So it's not something that we can tell anybody. And I'll give you a very specific example. When my mother was dying of ovarian cancer, she agreed to go through trials. And let me tell you, if I had my choice as her daughter, I would have definitely said to her, Mom, you're 79. You know, these are going to be tough trials. And trials means that they're, for those of you who aren't familiar with a trial, means that this is new medication they're trying out.
Yes.
But that was her way of her wanting to do something that might help someone else. So as much as I wanted to say that to her, it was something that I did not say. Instead, I supported her through the process of what she chose.
Okay, thank you.
Thank you for the question. Yeah, please. Ramla.
When you talk about, you want to talk about death to your friend, how do you approach it? Is it you put it into her mouth, or during the discussion that you talk towards, towards the ending of everybody will come to the end of our life,
Right.
and then when she is ready to talk about that, then you.
Yes. I think that's an excellent description. I think that's what I was trying to say, but you said it much better. Thank you. Very well said. Please.
Rohani. Rosemary, I think among the Malaysian, a lot of time they would rather that people not know that you have cancer.
Right.
So sometimes I think it's very important for us to approach the person very differently. Different people will act differently.
Yes.
I think I've been in contact with Mazda, even though I've not attended such program
Okay.
here, but I did volunteer one time, Wish to Recovery program. What I found out is it is very important for us to link them to connect
Yes.
or care immediately, because that will open up your mind. Because my approach is always to link to a resource center that will help them with knowledge and information about what they are going to go through, the process they will go through. But nevertheless, some people are very open, some people are not. So, but you have to keep on trying for those people who are not open until they find that it is important for you to get around the support group. Whether they want to go for treatment, it is really up to them. That's my opinion.
Oh, absolutely. And I still think that is definitely up to the person. And I know that I have a very dear friend who's Chinese, and she's Chinese Canadian, and she works in palliative care. And one of the things that she brought up through that, which I think is similar to other questions that have been asked, is that if a person chooses not to do it, even though you know as a medical specialist that it would be better for them to do it, you really cannot say to them, do it. You really have to respect their own values, who they are, what they're doing. But I also agree that if possible, if you can work with people to find ways to help them into the system of support, and that's where people who have had cancer can be very helpful, because there's this kind of connection that people sometimes think that that's the end, even though it's not even close to the end. And when they see somebody who's healthy, then they just kind of think, oh, well, I guess it's not the end. It's not even close. And so, and also talking positively at that point in time. So thank you. Any other questions that you might have? Yeah, please.